You mentioned you guys are continually active in finding new doctors, and you're utilizing a grant that's going to be exceptionally important. Talk a little bit about our guest here real quick, and you can go ahead and introduce them if you'd like.
That's a great honor. So we are always looking at ways, how can we serve our community? And we also need to make sure that that service is to the Vermonters. And one thing that we saw over and over again as we've been looking is podiatry. Had some gaps with some services we had to change. So because we need to be profitable so we can help our community.
Right.
No profit, no mission, right? So we need to make sure it's profitable. And so we began to see some areas and some gaps and things that we began looking around, and we were really blessed to find Dr. Woodlawn, who is local to us. He has practiced here in the Plymouth area before. Yes.
Yeah.
He's practiced here in the Plymouth area before, and I'm going to let him tell you maybe a little bit about himself.
Please do. Dr. Eric.
Awesome. So I'm Dr. Rindlisbacher. Eric, it's a long last name. You can call me just about anything is how it works. So I've been practicing in the Mishawaka, Plymouth, Elkhart area for about 10 years. I did residency out at St. Joseph Hospital up in Mishawaka. And then after that, was asked to kind of hang out there for a little while and work with the residency program. And I worked with the residents, training new doctors for about 6 or 8 years. And then a year or two ago, I've been shuttling around, opening new clinics for St. Joe. Had heard a lot of great things about Woodlawn and about Rochester and the community. Kind of understood there was a need down there. And made a couple phone calls, met with a few people over at the hospital, and it seemed like an excellent opportunity, and I'm excited to be down here. I've been going now for about 3 or 4 weeks, so it's been great.
Talk a little bit about being part of Woodlawn. What was the attraction?
So it was actually my first meeting with Brad. I think he comes on the show, I hear, every now and then. So I met with Brad, and then I met with a few of the other doctors, the orthopedic surgeon, Dr. Sheedy, and what I instantly felt was a attachment to the community and the care for individuals. And that I had been missing where I had been working previously, was just that level of, hey, I want to help the people here. And that actually drew me in probably more than anything else.
Knowing that you're going to get the support that is crucial for any doctor's practice, it makes life a lot easier to get things accomplished. For you, have you set goals about what you want your first year to look like with them and beyond?
Yeah, I think this first year, the important thing is to get us established in a way that we know that we can provide excellent service, right? And what's needed, right? Podiatry, foot and ankle, we do the whole range, right? I'm doing surgery, I'll trim a nails every now and then, all those things, right? And what I find is those kind of little things, those procedures, the amount of relief you can grant somebody is incredible. So I think if we can show the community that those services are available in their hometown, right? I think that's going to be what sets us up for success. And honestly, what I've seen in the 3 or 4 weeks I've been here is just the tremendous number of people who need some help, right? And so I would anticipate as you look even past, the first year and setting up and getting established, is that it continues to grow. Even for our small specialty of podiatry, I would anticipate it would even get bigger.
And obviously, I don't know the ins and outs to your field in podiatry, but it seems today people are just experiencing more and more health issues.
Yeah.
And, in the podiatry field, have you felt in all your years so far being in this particular field that the need for help just keeps growing and growing, as opposed to just hopefully being level and even hopefully having further people walk through your doors because of it?
Yeah, 100%. I mean, if you look at how sick people are, and I'll just relate it to the easiest thing that we deal with, or the most common thing, is diabetes, right?
Yeah.
The amount of diabetic complications that we deal with, especially in the foot, the ankle, the legs, is tremendous. I spent, most of my time working in wound healing centers, amputations, weekly. I mean, it's so tremendous, the volume, and it's not getting any better. It's getting worse. And I give a lot of credit. I worked, 10 years for another health system. I've been here for 3-4 weeks, and I've already had 3 or 4 opportunities to reach out to the community to try to provide some sort of, preventative advice, or, hey, if you see this, do this. And so I think, it takes a health system, it takes people, it takes doctors, nurses, MAs, all of us coming together to try to reach out, to try to do some of that preventative care that really, if you look at insurance things, we're not really getting paid for a lot of that. And so we have to do it on our own. But if it can prevent one person from losing a leg, I think that's incredible. My own father lost his leg to diabetes. And so it's personal to me. Like, I care about it. You shouldn't have to just go your whole life and not understand that there are things you can do to make it better.
I mean, you got a platform right now. I mean, is there a couple things that you want to, kind of preventative suggestions if a person's got diabetes that can help them out?
Absolutely. That would be wonderful. I appreciate it. The diabetes is horrible, but it is one of those things that, number one, is most often preventable. And number two, once you have it, just treat it. And if you treat it well and treat it consistently, then the complications from it are nearly non-existent. And so it's all about blood sugar, right? So if your blood sugar's high and you leave your blood sugar high, it's like you've got, sugar running through the veins. And so what I tell people, it's like when you talk about neuropathy and nerve pain, you talk about losing limbs and the blood flow issues. What happens is you literally sugarcoat these nerves and you sugarcoat these veins. They don't work anymore because they're coated in sugar, and you don't ever get that back. You can't take that out. And so prevention here, seeing somebody using the medications that we have, which are tremendous. And then as I look at it as a foot and ankle doctor, checking your feet regularly, right? The same sensation that I or you have, I can go walk down the road, have a rock in my shoe. I'm going to feel that. I'm going to kick that out because it's going to hurt. Well, as a diabetic, you don't feel that. And you walk for a mile, you walk for 2 days, you're at work, you have that same work boot you put on every day. I've had patients with nails up in their work boot that they've worn for a month at a time and didn't realize it was even there until they finally, someone saw the blood in the house, the shoe, and it doesn't take a lot. And just spend some time watching the feet, looking at them. And then the prevention, work with your primary care physicians. I'll be honest, Woodlawn, I've been some places, phenomenal primary care. I mean, the doctors there are outstanding. And they're doing a great job at preventing some of these things. So yeah, prevention there. Diabetes, it's a scary thing. Just embrace it full bore, right? Don't hide from it. Just do what you need to do and take care of it and move on. And then, there's a lot of other things we could talk about there, but I think it's important that you do it that way. Just take care of it.
Well, my listeners, I hope you understand, you just got some very important information right there. And a lot of it, too, and it comes mental, doesn't it? I mean, there's a mental aspect to this that not only is it, I don't want to say it's easy to kind of forget about, but it happens. You don't, and you may feel a sensation 1 minute, but then not for another 2 to 3 days, and all of a sudden it pops up again. Is that a tester, or is that one of those kind of scenarios where, okay, you just need to start monitoring what you're doing and what you're eating.
You should be monitoring it, all the time. And that's where the regular just healthcare that you need in a community is so vital, because in the beginning, you need to know, right? First of all, you need to know. I have so many patients that come to me with other issues, and then I'll ask them the question. I'll be like, "Are you a diabetic?" And they're like, "Well, I don't think so." And then you'll go look at the labs, and they're absolutely a diabetic, and they haven't been treated for years. And that's terrifying to me, because those are the type of people that, if that's happening at 20 or 30, well, when you're 40,
when you're 50, 60, yeah.
When you're 40, 50, 60, I'm the guy in the operating room cutting your toes off, right? And that's what happens. And I wish it wasn't the case, but that's the reality. One of the things with diabetes I think is so scary. If you're a diabetic with a wound on your foot, which is a tremendous number of people in this community, because I treated many here at the Wounds Healing Center, or an amputation, your mortality rate
Increases,
it's worse than colon cancer and breast cancer.
Wow.
And no one knows that. We don't talk about it like it's as serious as that, but it is. And so those kind of things I think are important just to understand. It's so serious, especially if you've got a sore or an ulcer, if you've had an amputation. That just tells you the degree to which that disease has affected your body.
So I want to just jump in here for a community resource that we have here in Marshall County many people might not know about. Gina Moore is at the Argus Clinic, and she is a diabetic educator. And so we have one of them, we have Gina in Argus, we have one at the hospital as well, on a part-time basis. Those are huge community resources, because correct me if I'm wrong, but a lot of what diabetes is what you eat and how you control those blood sugars through medicines, but also through food, right?
Absolutely.
So that's just a great community resource that I feel is very underutilized.
Yeah.
Well, you got a good one here, Krista. I'll tell you that much. I mean, Eric here is just top notch. And, are you able to put on personal, clinics or something like that? I don't know if I'm using the right word here, but just a knowledgeable, sit down with Dr. E about podiatry and, diabetes and stuff like that, and how it affects you and what you do. Are you able to do that often?
We actually have a podcast, if you don't mind me plugging our podcast.
No, go ahead.
So we have, it's called Doc Talk with Woodlawn Health. It's on our website. You can also get it wherever you get podcasts. And if Spanish is your preferred language, we also have a Spanish version as well. And so Dr. Leland's podcast are actually translated into Spanish as well. So that's on our website, but you can also access it wherever you get podcasts. And the Spanish podcast, we call it, hopefully say this, I wish I had Elizabeth here, and he can speak Spanish. She's way better at this than I am, so I apologize now if I butcher this. But Soleil Latinx is, it's on our website, but you can also look it up. We have a Spanish podcast as well. And we have one provider who is bilingual, and she does a monthly or bi-monthly podcast on educational topics such as diabetes,
right,
or when you go to the doctor or the ER. So we have those resources as well. But Dr. Rindl's podcast has 3 podcasts coming out. So the first one came out just a few weeks ago. Then we have one in August and one in September. So that's just a really great platform. If you want health information from local experts, that's the place to get it from.
Well, that's fantastic. So, and that's all on the webpage.
Yes.
And what's the webpage title again?
It's woodlawnhealth.org. And then if you go up
That's
to
easy.
About Us and then hit podcast, or the Spanish, we have the Spanish one links there as well. But it's a great resource for our community. It's something that we do to be preventative.
I, ever since I've got to know about you guys, I can't even begin to tell you how important it is to see the direction you guys are going, and yet keep that small hometown feel. You guys are big. A lot of people don't know that because you don't make it big. You just do your job, and I'm sorry, but there's a lot of facilities around here, medical facilities or I should say hospitals, that struggle doing that. They try, but they treat it as a larger scale. The feel is for me. You guys don't. You're larger scale, but you don't make it feel like it's a larger scale. When you walk in, there is a comfortable feeling. You know, you're going to get taken care of. And the same with your outlets like an Argus and, you know, Mentone, you know, and stuff like that, Akron, I should say. I mean, that's what we need, you know, and the town of Plymouth, you know, it's had its issues, you know, with healthcare leaving and in certain things. And, you know, like I said, I love the fact you're starting to branch out, but you know, you can only do so much. You know, we get that. But I think with the ability of promoting you guys like we do here on the air and the video stuff here that, you know, that we provide, I really think we're helping you guys along here because this is what we want. This is what I want. I want that hometown feel, you know. Because I got to admit, I'm not a doctor person. I'm not a visitor. I'm not. And it's because when I walked in the doors, this is through past experience, the feel was not great. Now, I also know probably the situation wasn't going to be great either. But man, if you can alleviate one of my stresses, that would really, really help. And that's what you guys have been able to accomplish out of the gate. So bravo to you guys.
You'll hear me say it over and over again. Healthcare, when decisions are made in the communities that we have to live in every day, it makes a huge difference. I always say the decisions that we make in our boardroom, I have to be at the school for my son, and I get to get the feedback, positive or negative on that.
Right.
I get it at church. So we're in the communities we're making the decisions for, and most of all of our staff and providers are at some level as well. And we have them out in our community. So we're not very far removed from our community. We're probably only one step back.
Yeah. Did I have missed anything? I mean, have we covered what you want, Doc?
No, I mean, I think we're good. We're open at the Schaefer Clinic down there in Woodlawn. We are going strong, and you know, here to help as best we can.
Well, what a pleasure it has been to meet you, and you know, Dr. Sheedy is also you know, working with Woodlawn Hospital, and we just love him. And he's a very familiar, you know, name here around the Plymouth area, and just a great guy. And he's just good. He's just good. And so you guys are in the right mode right now, right direction. And that's just very comforting to know that Woodland is just a few, you know, minutes away from. If you ever need that care, you're going to be there. And so that's really what it's about. So, but I get a feeling on the track you guys are going, it's going to get bigger for you. And so that means your job is going to be a little bit more busy, Krista, but you know,
It's true.
But I just feel it. I every time I talk to you guys, there's just something that's very unique in the practices and that you guys are offering. And I don't know, you got to have the right people in order to give a person like myself that kind of warm feeling. And so, like I said, keep up the good work, man. I mean, this is a good cup of coffee here. So thank you again for joining us.
Yeah, thank you so much for having us. We love coming up to Plymouth. We see Marshall County is just an extension of our community.
Doc, best of luck to you, buddy. Keep
Thank
up the
you.
great work.
I appreciate the time.
All right, so when we come back, we've got more. We're going to be talking with a special comedian who's going to be coming to town here at the Reese Theater. So that's coming up after this, 9:30 your time.